Hi, I'm John Holubeshen, and I'm here to talk to you a bit about the laser that Moufida and I ended up buying to treat her basal cell carcinoma. So I started my search locally, didn't find much, did find one used laser. It was an 80 joule per pulse laser, but it was in the $50,000 range, so that was a non-starter. Next step was to start checking eBay, which is ultimately where we ended up buying this laser. It was just over $1,000 Canadian. Did purchase it, and it shipped actually within about a week. It came, we plugged it in, fired it up, and it didn't work. Turns out the laser they shipped was rated for 220 volts. Anyway, some tinkering inside, got that part to work, found some other issues. Part of the assembly inside was actually broken and loose. The water cooling system was actually leaking a bit. The laser head itself has tips that go on the end. The inside mechanism had shifted, so we couldn't get them in. So anyway, several issues. We did get a bit of a refund because we had those issues, but in the end, we got it working. I'll give you a quick demo here of how we used it and how it worked for us. For this, I'm going to use the black paper to represent the blood vessels that are feeding the tumor. The white paper has the skin over top of it. And here's the laser itself. We can focus the laser a little bit by pulling the laser back or moving it forward. And we didn't know what the ideal setting for that was, but we just kind of played it by ear. So in this case, I'll show you what happens when it hits the black paper. Oops, forgot to hit ready. So you can see where it's ablating the black. So if I go over the paper, which would represent the skin, you can see it's not doing anything to the overlaid paper, but you can see that it is zapping the black below it. It's not zapping it as hard, but if I zap several times in the same spot, we will get a more of an ablation, which is kind of what we did, for Moufida's tumor. Works great on paper, and it seemed to work on her tumor as well. It's been 4 months since we treated, and there's been no sign of the tumor coming back. So, we're gonna count that as a win so far. So that's pretty much what we did with the laser. So when we started on this adventure, we weren't sure if this was going to work. The laser was considerably less powerful than the one used in the study, 2 joules versus 140 joules per pulse. We don't know exactly how many pulses were used in the study, but they did indicate that they pulsed until the skin started turning bluish, so we kind of tried to do the same thing. We started at about 500 pulses, worked our way up to 10,000 pulses. The tumor actually takes time to die and get absorbed. We didn't know. We wanted to err on the side of getting rid of it, so we likely overtreated it by a considerable margin. The end result is that although Moufida has a slight depression in the skin, it looks healthy and there have been no signs of recurring tumors. As far as the power setting, although it's a 2 joule laser, it's got a much shorter pulse. So it's in the nanosecond range versus a millisecond range for the more powerful laser. So it's actually delivering more power in a tinier time frame. Whether that makes a difference, I don't know, or whether it's a total power that makes the difference. So in our next video, Moufida and I will talk about, our final thoughts and reflections on what we went through in the whole process of basically delving into something where we didn't have a clear outcome, but, it was worth the risk to us. And so far, the results seem to be pretty good. Fingers crossed. Anyway, thanks for watching. Please hit subscribe and like, and we'll see you in the next video. Bye.